Apparently, the world has not seen the end of the coronavirus pandemic, as the current Delta variant is spreading like wildfire across many parts of the globe. This has forced a growing number of countries to reimpose lockdowns and other public health restrictions, raising fears that the more contagious variant is hampering global efforts to contain the pandemic. It has also led to surges in COVID-19 hospitalization and deaths, largely among people who are not fully vaccinated. While some countries on the African continent, such as South Africa and Zambia, are recording daily cases of the variant, the Nigeria Center for Disease Control, NCDC, maintains that there is currently no case of the COVID-19 Delta variant in the country. Nonetheless, the federal government has begun to take measures against the variant, which include imposing a travel ban on travelers from South Africa, as well as extending travel restrictions on India, Brazil, and Turkey. Now, how dangerous is the COVID-19 Delta variant, and what other measures, apart from travel restrictions, are in place towards forestalling and mitigating its impact? These are some of the issues on the front burner on this edition of Nigeria Today. Welcome to the program. I am Dennis Adigunloye. All right, with me in the studio to discuss COVID-19 Delta variants, we have the former DG of the Nigeria Center for Disease Control. He is Abdulsalami Nasidi. You're very welcome to Nigeria Today.
Thank you very much.
All right, to start off with, just tell us what are the origins of this Delta variant that has come into play in this pandemic.
Well, unfortunately, at the verge of, the world defeating the COVID pandemic, a new variant that of great concern appeared, and it was initially called the Indian variant. It appeared in around October-November 2020, but it became, a variant of concern. That is a variant that we should not ignore, that will cause trouble, sometimes in March this year, when a sudden upsurge of cases started occurring in India, and the whole world saw how this happened. Then, middle of this outbreak, it became very clear that that variant, which was called the Indian variant and now renamed Delta variant, is replicating very fast. And before we know where we were, so many countries became contaminated with it. And another mutant of the same variant came out, and it became even more potent, than the parent one.
And you say that it's moving faster, and by implication, it's more easily transmissible. Why would you say this is so?
Yeah, unfortunately, the changes that occurred in the parent virus, made it to be easily transmissible, meaning that jumping from one person to the other. So, if one person is infected in a community, within a short period of time, you'll contaminate so many other people. Faster, higher than the known viruses, like the Wuhan virus and the one that appeared in Britain. And this is because the mutation, took off very fast, and it replicates faster than the known variants before this one now. That means it's actually multiplying, in the human cell faster. So in that case, it becomes more potent, and at the same time, it's also seen to be evading the immunity that people have developed against the other, coronaviruses. So because the virus replicates fast, because it's much more transmissible, jumping from human to human faster, and at the same time it's like covering, away, like it's having a camouflage to deceive the human body immunity. It became more dangerous. It's killing more people. It's causing more severe cases, and of course it became the variant that the world is more concerned about.
Sure, definitely have to be concerned about it. Just to explain to us the science behind how a virus mutates and becomes more potent and dangerous to humanity. How does it work?
Well, the viruses are the tiniest living particles. You can't say they are organisms. They are not organisms that are existing, even though they have something called prion now. And they have capacity to infect everything. They infect humans, they infect animals, they infect plants. So the mechanism of having some of them to be causing diseases in humans is mostly when they jump from animals, to humans. That's when most of the ones that we know so far causing the pandemics, that's how they behave. The Ebola one, the Lassa one, they all jump from one animal or the other to humans. And then why do they really cause the disease? Is because when they enter into human body or human cell, they start getting adapted to those cells. And if they get adapting to those cells, they start replicating and multiplying in those cells. That means when they infect any human body or human cell, while they are multiplying, those cells will be dying. As those cells are dying, they will be causing disease. If it is liver, they are infecting more, they cause liver disease. If it is lung, they are infecting more, they cause lung disease. If it is stomach, they give you acute stomach and so on, things that can give you some pains and disease of the stomach, or if it's kidney, etc. So most of them have organs they like to target. And some, unfortunately, even target many organs, like coronavirus. It attacks both the lungs, the liver, the internal organ. It causes what they call pan-organ infection. So that's what makes these viruses to be dangerous. They can easily adapt to human cells. They can even go further than just causing an ordinary disease and causing cancer. Some of them are now known to be causing cancer. So, and this is because they have ability to enter into the human gene, and start dictating to the gene what to do. So if they enter into human gene, where their own gene enters into human gene, they can do what they call coup virage, as the French call it. That is a coup, a virus coup in the human body. They now start telling the body what to do. If they transform that cell, they can become cancerous. So the cell will be multiplying without control. And then they cause cancer, like the hepatitis B virus, the hepatitis C virus, that is now rampant everywhere also, even though they are not causing pandemic, but they have high capacity to cause cancer, liver cancer, and which is one of the #1 killers of male in Africa. So you can see that we should be very concerned about these viruses. They can cause acute infection, chronic infection. They can cause, highly severe cases that leads to death, and they can even cause cancer.
Wow. And how does this, where does this leave the global fight against the pandemic? We've seen significant progress being made with the vaccines that are now being widely distributed. How does this new developments impact on the global morale in fighting this infection or this virus?
It's such an unfortunate incident that is occurring, so many instances the first time in the history of pandemics. One, development of the vaccine to fight the corona pandemic, was very, very, fast. The fastest ever vaccine developed against any new disease. So humans made big progress. They've identified the virus quickly. They used it to develop a vaccine, and it's being used to fight the disease. And progress was being made. The rich countries that have managed to vaccinate more than 40, 50, 60% of their population have seen a sharp drop in the cases and deaths, from coronavirus. But in the middle of this, something started happening. These variants started coming up. We have alpha, beta, gamma, and delta variants. And these variants started doing as if they are going to evade the antibodies developed against these vaccines. And the unfortunate thing is what we are seeing, especially in Britain, where Britain did so well. They vaccinated a large proportion of their population very quick, and the cases dropped, and they were about to start lifting up all the lockdowns, all the restrictions, and then this new strain started coming in from India, from Southeast Asia,
Yeah.
and it's reversing their gains. It's as if the variant against vaccine, the variance against our progress.
Yeah.
So how do we avert it? So luckily for us, the good news is that at least even though they are causing still cases, but they are not causing severe cases in those who are already fully vaccinated. So which means the vaccine still has capacity to reduce the severity of the disease caused by this COVID. So for instance, it's in the US, in the last 2 months, virtually all deaths from COVID that are occurring now are occurring among those who are not vaccinated. So those vaccinated are having protection against severity. They are having protection against ability for it to kill.
Certainly that is positive coming out of the new developments. What population demographics, I mean, we talk about India and Southeast, what demographics are more prone to contracting this variant of COVID-19?
Yeah, you know, the mother virus, or the first strain that was called the Wuhan virus, when it appeared, it was killing mostly the elderly.
Okay.
And, you know, so that's why there was targeted, you know, vaccination of people older than 40 years, 50 years, and so on and so forth. But as that vaccination was going on, and cases and deaths were reduced among this age group, as achieved in developed countries. Not we don't have the vaccine enough yet, and but they start seeing that younger people, younger age groups are also coming down with the disease and all this. Then when they started checking, they found out that the virus causing those ones are this variant, especially the Delta variant. So it's the same demographic like the Wuhan one, but unfortunately is going into younger generation.
All right. Okay. We'll continue discussions very shortly. You're on to Nigeria Today. Stay with us. We'll be right back after this break. All right, you're welcome back. You are on to the program Nigeria Today. Our topic, we are discussing the Delta variant of COVID-19. We have in the studio Professor Abdulsalami Nasidi, former Director General of the Nigeria Center for Disease Control, NCDC. Prof, NCDC says that there is no case currently in the country of this new variant of the virus. How worried should Nigerians be, bearing in mind that, like we've been saying, this particular strain spreads very fast? How concerned should we be?
Well, as we are seeing from other countries, is you don't wait until you are sure that you have seen the strain in your country. It can take you by surprise.
Yeah.
And we can't even say categorically that yes, you know, there is no Delta variant, yes, because our testing capability, especially genomic surveillance, is not yet as strong as this. But nevertheless, the tests carried out so far have not revealed any of the patients to be having it. Only in the last 2 days, as from Sunday to today, something is happening, and we are really, hoping that it is not. But so far, at least, what we need to do is to start, as you rightly ask, preparing the nation on how to be prepared so that this variant does not come, and take us by surprise. Because the Delta variant is described as the fastest and the fittest, because it comes into a country within a short period of time, it surprises you. If you remember what happened in India, India produces vaccine, they manufacture drugs, they are a strong country, they are world power, and they thought, oh, we are done, this disease will not affect us. But when this strain, the variant came in, it shocked them. And now South Africa is the next one that is experiencing this type of something. South Africa government thought, oh, so we're going to defeat COVID, we are doing very well. And surprisingly, they now saw that the cases are increasing. And as I'm talking to you now, in the African continent, about 12 countries are already experiencing, this outbreak. And from the record, we have almost 500,000 cases. Almost 500,000 cases have occurred on the African continent.
Over what kind of time frame are we talking about, those 500,000?
Yeah, the first cases and evidence of, Delta upsurge, in the African continent started 3rd of May. And between 3rd of May and today, you can imagine the number of cases that are recorded. The increase in the last 48 days is, almost how many? 48%. It was 26% before, 48% higher than what it was for the same period last year. Wow. So that means the possibility that African continent might be hit with this terrible outbreak, is very high.
Definitely a high risk, given those figures. Yes. In view of these, we all know about the travel restrictions many countries have imposed, not just with this new strain, but when COVID itself initially broke out. How effective would you say travel restrictions have been over the past year or so? And do you feel that another approach is maybe necessary with regards to containing this new strain?
Yeah, in fact, because as I had mentioned that this variant is very fast, spreading faster than any other one, and also it's a fit variant that defies most of the restrictions and regulations that we have been following, the protocols. So there's no way that the travel restrictions won't work. If we know countries that this virus is spreading fast now, and we leave our borders open and we don't restrict them from coming, we're asking for big trouble.
Definitely.
Also, even during the first surge, the first wave in Nigeria, when we impose now travel restriction from Europe and other countries, we saw that there's a sudden drop in the cases. So we're very sure that Nigeria should not waste time to really start imposing not just restrictions, travel restrictions, but they should impose travel restrictions from particular countries that are having this upsurge now. That will go a long way. Then we should also start working on measures to prevent or minimize super spreader events. And we saw that the Indian case occurred when they had the River Ganges, those Hindu celebration, and some political rallies. We are very careless here. We are still, following all those, super spreader events. We are doing our parties, etc., without restriction. I think if we really want to survive and, be spared by this third wave, we need to start doing something about those things. And lastly, the religious activities. We know that one of the major religious pillar, in Islam is Hajj. And Saudi Arabia makes billions from Hajj operations. But knowing quite well that if they allow Hajj this year, and people come from the Southeast Asian countries and Muslim countries from other parts of the world, they could suffer more from the third wave. They had to suspend Hajj, and that's a very tough decision. So Nigeria should suspend any possible super spreader. Some of them are obvious, like some of the impending burials of our strong religious leader that passed on, like the upcoming Salah celebration, which we have to really work on our people to observe social distancing, wearing of mask, especially in where you have to go where there are many people.
You talk about the carelessness of the people here in Nigeria. No doubt everyone is aware of the non-pharmaceutical measures, wearing a face mask, as you say, washing of hands and social distancing. How complacent would you say Nigerians have become despite this new variant that has hit certain countries? How complacent are we here in Nigeria?
Yeah, well, I can't blame Nigerians. Nigerians have not been sensitized on this impending danger. And I believe the Honorable Minister of Health, is already gearing to start doing that, because yesterday we had an emergency meeting situation room where all these measures that need to be done were addressed. And I'm sure the advice given will be taken by the ministry, to start sensitizing Nigerians. And, there is what we call the fatigue, social fatigue. The Nigerians are like getting tired, and they are not seeing cases. So, there's no more corona, no need for masks, no need for social distancing. But, we don't need to wait until we start seeing the Delta cases increasing, because we have large population, densely populated areas, and if it comes, it can spread, really fast. So we are calling on Nigerians again not to be tired, but to trust the public health, workers of the country, that there's an impending danger, and we don't want Nigeria to be a victim.
Absolutely, and we are certainly hoping that it does not come to this, but should the virus get to the borders of Nigeria, are you confident that there are sufficient measures in place to stop the virus from entering?
Well, I can say that the port health services of Nigeria have done very well, especially checkmating this virus coming into Nigeria through the ports, airports, and of the nation. But we have very loose, land borders, and that could be a real problem. How to get this done, and so we remain very vulnerable if we cannot increase and support our security mechanisms at these borders. And it shouldn't be seen as if it's only port health. It is a combined effort, and that's what Nigeria did very well. I think we're very happy to see that at the peak of this pandemic, Nigerian security agencies came together with health workers, like the immigration, like the custom, like the police, all at the border. They did very well, combined effort, and we could do much more. But this virus is vicious, it's fast, and it's really, really, how will I say, fast in terms of taking you by surprise. So we have to intensify our surveillance activities at these borders, and now really engineer what we need to do at the land borders, empower the people on those land borders to make sure that this thing is not brought in by foot.
All right, definitely very important message there, and to all those out there watching, the virus is fighting back by all means possible. Continue to take precautionary measures and follow all non-pharmaceutical measures. Wear your face mask, keep your social distancing, and keep yourself hygienic. Wash your hands. Professor Abdulsalami Nasidi, former DG NCDC, many thanks for sharing your thoughts and expertise and advice with us. Thank you very much.
Thank you. And good evening, Nigeria.
Thank you, sir. And thanks to you out there for watching. Nigeria Today is live every weekday at 7:30 in the evening. Also catch this and other editions on youtube.com /NTA News 24 Hub. I'm Dennis Adigunloye. Thanks for your company.